Welcome, Dr. Mozammil, to our channel. Thank you so much for your time here. First question that I would like to ask you is, please tell us something about your classroom to cubicle journey. Like, where did you start your schooling, university, and then like what are the organizations you joined? So, if you could please tell us about that.
Um, the first thing, actually, it was a dream of my parents for bringing up their child to be a doctor. So it was the first incident. What happened when I was in fourth standard, and I was a lad of near 10 when my father met with a severe CVA, cerebrovascular accident. So I was in fourth standard. I was a lad, and then during those days, I used to accompany my mom. My father was admitted there, and he was comatose for 3 days, and he was in very serious condition. So, and he had that a day, means about 17 days he was admitted there. So when I used to accompany my mom to the government hospital, then I realized what is that whole medical scenario. I was young, and for the first time I got exposed to the hospital setup. So during those days only, to some extent, I started aspiring that I will also become a doctor. When I used to see those senior consultants used to visit my father, and I was just a lad. I was helpless. I was just seeing them. So during those time, it was my personal aspiration that I will become a doctor. And before that, my parents always wanted me to be a doctor, and this was the first ignition. Then I completed my schooling from St. Augustine's Day School, Kolkata, and after passing off my plus two with that good performance, I performed well, and after that I prepared for my joint entrance examinations and all India PMP examinations. I cracked the examination, got admitted in one of the prestigious institute of Kolkata, IPGMER Kolkata, SSK Hospital. And therefrom, I began my MBBS journey in the year of 2007. So then I completed my MBBS from IPGMER. That was an exhaustive duration of 5.5 years. 4.5 years we had our classes academics, and then 1 year of internship. And then I was there as a house physician in IPGMER as a house physician there. I worked there for a year, and then I prepared for my PG entrance, that is postgraduate entrance. Once you have completed your MBBS, you have already completed your graduation. So then you aspired for the post graduation, that is MD or MS, whatever field you wanting to join. I appeared for that examinations, and by Almighty's grace, I cracked the examinations. My all India rank was 300, 326 rather, and then I joined uh, MD Radiology, MD Radiology in Patna Medical College. After that, I was given, and that course duration is for 3 years. From 2015 to 2018, I was doing Patna Medical College. In 2018, after completing my MD, I shifted to Delhi, and 2018 I appeared for one of the examinations of AIIMS New Delhi for the post of senior resident. And Pan India, it had only 2 seats in the field of neurointervention, neuroradiology, and somehow I got managed to get it there, and it was a dream. Rather, it's a dream for any doctor in India to be a part of All India Institute of Medical Sciences, AIIMS New Delhi. It's a prestigious institute, and in 2019 January I joined there as a senior resident. And since then, since then I've been I was there for about more than a year, and now I'm practicing as a senior consultant in Sonostan, Kolkata. So what I'll say, maybe it was exhaustive, rather the journey.
That's great. That's great. It only sounds so exhausting, and I can only understand. Like I'm just trying to understand how this particular journey has been so fruitful. But definitely, it takes a toil on anybody. A dedicated person, a passionate person, can only fulfill these aspirations. Otherwise, it's really difficult for a common man to pull any of that.
It's all about the journey of a common man. It's not that you need to be. having some huge player, or you need to be a superman. It's just a common man, and then it's all about the aspiration you have, and the you are ready to be patient, perseverant, and ready to fulfill the dreams what you have, and the dreams what your parents want to fulfill through you.
Great, Doc. Great, Doc. That's really good to hear about all these things. Uh, so, I know, like you've talked about the qualifications. Firstly, of course, a person has to study science in his plus twos and then appear for the All India examinations. Now, I think it's the NEET. So, once the person qualifies, he does the MBBS, and after that, if he wants to go for further studies, does the MD in his or her particular field of choice. Now, if I ask you what it really takes to be a doctor, apart from all the qualifications and apart from all the examinations, because I'm sure uh, everybody knows that if you want to become an MBBS, you need to clear the All India examination. Otherwise, what's that's something that people see it from the front side. But every grass is not greener from all the sides, right? So, what are the gray
Yeah.
areas, and what are the things that it really takes to become a doctor in India?
The first thing is patience. You need to have huge amount of patience and perseverance. Uh, it's because being doctor in India, in comparison to any other Western countries, where you are having lots of opportunities, and you have ample amount of institutes where you can apply for. In India, it's very difficult because if you want to get in through a routine procedure, means, if you're not going back door, if you're not affluent enough and afford a seat through capitation monies or donations, it becomes very difficult for anyone who is of a mediocre background, or who is of a middle class family. So the first thing is that the entrance examination, the competition level is very intense, because for that skimpy amount of seats, you have multitude of people applying. So getting through the examinations and getting seats secured there, it's difficult. Even if you the thing is that the margin of error is very less. And the guy who tops with 99.9 percentile, and again a person who is scoring about 96 or 97 percentile, they fail to qualify. So it's not that they are of, it's not that means of qualified, or they're not that much talented, but it's all about the sheer luck. That small amount of that small margin makes a huge difference there in this intense competitive environment. And one thing you wanted to say, what else you want? First is patience, and then the hard work. Because being an engineer or any other field, you have some options where you can reboot things. Means if you make an error, you can again reboot things. You can format things. But here we don't have that option. You cannot format. If you make a mistake, you lose a life. So this you need to have nerve of steel rather. Means you cannot be jittery. You'll whatever you want to, you'll have to do it. You have to be confident enough to make decisions and then proceed in the patient management. Yeah.
Thank you so much, Doctor. Next question that I really want to ask you, it's a personal question. Every doctor aspires to become a doctor or associate themselves with AIIMS, even if they are not a residential doctor, somehow, practiced one day at
Yeah.
AIIMS, or, a visiting person at AIIMS. So why did you leave the most prestigious way or the most prestigious place where any doctor across India or overseas, they can, associate themselves with?
Yeah, yeah. It's a good question. No doubt, AIMS in India is a heaven for any doctor. Since everybody even it was a dream for me. Then I got into the medical institute. Since then, since day one, I dreamt of stepping into AIMS as a doctor out there. And by Almighty's grace, Alhamdulillah, I got the chance, and I became the senior resident out there. There was just two seats all over India, and I and one more guy from the South India. We both qualified. We were there, and it was going good. But again, I was there with my family, my mom and my wife. It was difficult for them. Actually, my duty hours used to be very very hectic. As you know, the duty schedule of resident doctors in good institutes like AIMS, we don't have any fixed schedules. Many a time it happens that I entered my duty on Monday, and I'm returning on Wednesday night. So it was at a stretch for about 60 hours. So it became very difficult for them to carry on because they were in a new city. There wasn't any kids folk out there. So my mom, especially my mom, was feeling very ungood, and she wanted me to go back because it's hard time. I was there outside Kolkata for a long time during my MD exam preparations on my when I was pursuing my MD course. So she told that it's high time. And again, at the back of my mind, I always wanted to get settled back to Kolkata. And since my childhood, I am against the concept of brain drain because when I'm a doctor, I feel that the first people who owe me is my kids and my kids folk, and the people in my vicinity. So I need to serve them first. I'm against the concept or the notion of brain drain. Because when I was doing AIIMS, from AIIMS, it's very easy to go and apply for overseas. I was getting options. I was getting options for Canada and many other Gulf countries. Many of my colleagues opted that took that option, and they even tried to convince me why you're going back to Kolkata. You're going for retrogressive metamorphosis. It's from a very good place. You're again going back. Again, it was my personal or emotional attachment for the place that I will get settled back to like Kolkata, and I will serving my.
This becomes a tagline, Dr. Mozammil Hassan is a family man, the family man. We can have a web series again.
No,
but
no,
but
it's
I really appreciate.
family. Obviously, family obligation was there, but again, I told you that my personal option, that personal urge that I want to serve the people of Kolkata first, and then if it is possible, then I'll have to go. Means I'll expand my service.
Now, the next question that I want to ask you is a very common question, and it saunters the brains of almost every person who is born and brought up in Calcutta. Right, in their profession, they always move out from Calcutta because of better opportunities. For me also, I have been born and brought up in Calcutta, but
Yeah, yeah.
5 years I struggled in Calcutta and I had to move out to Delhi. So right now I'm in Delhi. So in case of your profession, in case of your noble profession, being a medical officer, being a doctor, uh, how different is it? Being a doctor in Calcutta versus being a doctor in Delhi.
Mm, Uh, I don't think so. There is much of difference. The only thing is that in Delhi you have much more job opportunities because there are premium institutes out there, and you have uh, a battery of big corporate setups. So the job opportunities out there is good. Good in the sense that that is the only difference. But again, once you're attached to a good institute or good setup, it hardly matters. And obviously the life of Kolkata, I feel, is more at pace rather than the life of Delhi. I've been there. The life out there is very fast. It's very fast, very mechanical. People doesn't have time to what I'll say. They don't have time any time for leisure.
I agree.
So if all those who are there in Delhi, they have very high aspirations. So that emotional bonding or that thing, that emotional touch, I lacked there back in Delhi. The reason which pulled me back down to my hometown of Kolkata.
Great, doctor. So, doctor, like anybody who chooses a profession, of course, it's because of the attachment or because his family's dreams or his own or her own dreams. Now, but we cannot shy away from the fact that we need, of course, money is not everything, but we need money for everything. Now, if
Yeah,
I
yeah.
ask you that doctors, how do they earn money today? So, if I go back 20 years, people know the traditional ways in which doctors can earn. Doctors used to earn that at that point of time. How about today in 2021? What are the avenues in which a doctor can earn money apart from working in a hospital or a nursing home or his own? So yes, I would like to hear that from you.
Uh, See, it's very conventional. The conventional way of having your livelihood or remuneration, it is continuing. When you attach to a particular setup, you have fixed salary. Apart from that, when you're doing private practices, you have your consultancy fees, and if you are the one thing what is advantageous in this field is you can have number of attachments. And it's not that you're fixed to one particular institute or in a center. You can have number of clinics and nursing homes. You can visit a number of nursing homes. So these things gives you an ample amount of options where you can have your constant flow of money. And obviously the flow of money has increased drastically. What was 20 years from now, 20 years before, the remuneration or the scale of livelihood wasn't that raised as what is nowadays. That. And especially in a big city in Kolkata or in any mega cities, they have lots of job opportunities. And hardly I have heard any doctor who is sitting idle or who is having short of economies. That is financially crippled. It's very rare. That even
Right.
not only in cities, even if a doctor is there in the rural areas, they are doing good because that is the only this field of hospital, this hospital sector is the only field which doesn't get affected by any of the chaotic situations. What, for example, in the COVID crisis or any of the crisis, global crisis, all the sectors get affected, but not the sectors of the this medical field. In this field, we don't have that dip in or any downfall rather. So the flow of money is has been in a what else? It's in a raising pattern. That is, what was doing 20 years from now, it has increased manyfold because the corporate sectors and the hospitals and the nursing homes are continuously multiplying in all the areas and all the avenues, and especially in the cities, in the urban areas.
Right, right, doctor. So yes, this is one of the reasons why every Indian parent, when a child is born, they say that my
Yeah,
child will become a doctor. Right,
yeah, it's because of a secured livelihood. There. It's very secure.
great. Now the next question that I have for you now, this is due to Bollywood completely. The way they have picturized
Yeah,
doctors in
yeah.
many situations,
Vilified the doctors.
glorified the doctors, and also there is a section of the society, maybe the fate was not with them, or they could not believe the reality, accept the reality. So there are many people who feel that doctors are frauds. I mean, please excuse me for this question, but I'm being very direct for people to understand that what is this scenario. Like, is it do doctors perpetually ask for more fees, or perpetually they this scenario of doctors being frauds and excruciating money from patients. So, what is this scenario? If you could just explain,
Nah,
please.
nah, nah. Actually, yeah, to have this notion in your mind that all doctors are fraud, it's blasphemy. Because majority of doctors are of noble intent. Black sheep is bound to be there in all the fraternity. So I don't deny that we all doctors ourselves. We are like deities. We are not deities, but there are some characters who are money minded, who want to make money by by any means rather, maybe resorting to unfair means. So it is highly condemned. It is highly condemned throughout the medical fraternity. But majority of the doctors are really working for the noble intention of serving the population, for doing good. It is for their sheer benevolence. And money. See, making money. I don't think so that it's a crime, because when you have given so many years of your life, so if you want to make money, it's not a crime. It's not a heinous crime anyway. And the only thing is that it should be unfair. It should be unfair in the sense you cannot extract money by prescribing unnecessary medications because you are being giving commission, or advising those investigations which is not required. So it is at time it comes into our mind, and it is highlighted in many of the incidents in the social media and in the news, that many such incidents come up. But these are skippy incidents which are the black spot of a fraternity. And obviously this is not in majority. It's very skimpy. And these actions needs to be condemned, and these actions needs to be amended and rectified. And all those doctors who are having these things, we have those that measures that the that those who does these things, they are resorted to penal erasure, where their licenses are being confiscated, their practices and their degrees are being confiscated, and they are being asked not to practice anymore by the law of India.
Great, great. I am sure because I have met a lot of doctors in my life. I haven't seen anybody excruciating money from a patient.
Yeah, yeah, yeah.
For me, all of them have been good, noble, and people with gratitude and people with no attitude. People, frankly speaking, my experience has been that. The next question that I want to ask you is: so becoming a doctor is not easy. Everybody knows this. You need a lot of sacrifices starting from your school days. So when you take science in
Yeah.
your 11th and 12th, I know, like I took science 11 and 12, and I could just understand how much you have to study. So from 11, 12 to all the years when you were learning how to become a doctor and when you became a doctor. So what are the sacrifices required? Did you party? Did you play games? Like, or nothing? Only study, study, study.
No, no. It's a wrong concept that you don't get involved in any of the recreational activities. But it is very much correctly stated that you need to be very hardworking. Because when I was preparing for my entrance examination, my daily schedule was fixed that I'll have to study for 10 to 12 hours. So it was an average 10 to 12 hours after I completed my plus two, and then I sat down to study. I got admitted in one of our local colleges. I took microbiology. I didn't attend any of the classes because I was of firm adherence that I'll have to crack the PMT, pre-medical test examination, entrance examination. So I locked up myself in a hall and one room, and then I was preparing, and I used to prepare for 10 to 12 hours a day. And it was once when I used to hear that people are studying for 12 hours, 14 hours, it used to be something very next to impossible. But when I started preparing, when you have that ignition, that propulsion from that will have to get through, and the intensity of competition was so high that you cannot afford to do any leniency whatsoever. So any leniency from your side will get yourself out of the race. So that thing kept me go on, and during just before my examination, my duration of study increased. Rather, it was the highest. What I recorded was 18 hours at a stretch.
Oh my God.
That was 18 hours of study at a stretch, just a few days before, and then I curtailed my sleeping hours and many other activities. That during that period, when you are preparing for about a year or for about 8 to 10 months, you have to curtail yourself from any other activities. A small amount of recreation is allowed. That is, it's just to rejuvenate your brain and at that time when I was preparing, we never had that this social medias or internet logins and all those. So we were out of that. We got ourselves completely isolated from the outside world so that we don't lose our focus. So and it becomes easier when you are preparing. You are preparing in a group lab, because once you are preparing alone, it becomes very difficult for you. It becomes very hectic and dangerous because you will get into depression because you're completely isolated. You're not talking to anyone. You're not sharing agony is what you are going on, and the pressure you are going on. You cannot get it out. So it becomes very difficult. And so the thing is that you have to be hardworking, you have to give full dedication, and apart from that, small recreational activities is allowed in at scattered throughout your that busy schedule. When you are having this schedule, packed schedule, and in between those packed schedules, you need to have those recreational stuffs. Whether you chat with your friends or you go out, just have a stroll down the road, go to the park just for enjoy the leisure time, and again you go get back to the thing, back to the job what you have assigned to do rather the studies and all this.
Great, great, great to hear that from a doc. So when you once you become a doc, now you have your dedication has paid off. Your all the late nights, the no sleeping, everything has paid off. Now you have become a doctor.
Yeah, yeah.
Now my question is for the new doctors, like who have just passed this year or maybe last year. what would your advice be for them? Start off with.
First of all, those who have already completed their MBBS. So during that internship, that duration is a time when we tend to get astray, especially for those who wants to pursue their post graduation. Internship is a good time where you need to start up with after a break of about 1 to 2 months. When you have started your internship posting, in 1 to 2 months you can enjoy, you recreate, but again you'll have to get back to your studies. In the sense, once you have completed your duties, you get back to your hostel or the room to start off solving the MCQs, because we have multiple choice questions. So you need to practice those MCQs and start preparing for PG entrance examination beforehand. Because you think that I complete my internship 1 year, that 1 year when you're out of your academics, and we have that 4.5 years, when you are again when you're preparing or appearing for the entrance examination, you have to again means answer the questions of that 4.5 years. So once you're having this lag of 1 year, it will be very difficult to get recapitulate those 4.5 years syllabus, that exhaustive syllabus. You have 19 subjects, 19 subjects, and then writing down an examination of that the duration of 3 hours. Again, recapitulating those 19 subjects and that 1.5 years syllabus, it becomes very hectic. So it's my advice that in your internship time, you take out some time after your vacations, after your duties, you take out some time to solve out MCQs and be in touch with your academics rather than boogieing around, because it's a very common thing which I use. Even I also got astray during the early days of my internship. Because once you have completed your internship, you feel that you are in cloud nine. You have already completed your MBBS. Now it's just the internship. It's a formal posting, and after that we will be given. Once you are intern, you have already received your provisional registration number. Once you
Right.
complete this formal posting, you will be getting a permanent registration number. So that is a time of working. It's we get out of academics. So then again, when you get back into the track and you want to write down your teaching examination, it becomes difficult. So my advice will be you carry out your clinical postings with dedication and honesty, because that is the time where you will be learning all your dexterous activities for channeling, BP and everything. Those small things, for example, procedures, the catheterization, vials tube insertion, all those procedures. That is the time when you will be learning these things. And once you complete your internship, after that you won't get that opportunity to learn these small dexterous activities. This IV catheterization, vials tube, and any other procedures there. So that is the best time where you can learn and strengthen your clinical stuff. And apart from that, after when you get time, you get back and practice your MCQs.
Great, Doctor. Great. That's very good to hear. I'm sure people watching this will be benefited from this. One question that haunted my mind, and I had read in certain newspapers as well. So, should doctors in their initial years at least practice? Should this be a mandate that every doctor who passes an MBBS should be going to the rural areas and practicing for at least 1 or 2 years, maybe?
Um, Now, it's a good thing. Doctors in early years needs to be in rural area, but I feel it shouldn't be a compulsion. Because if a person is there in the urban area and if he's serving the slums just in their vicinity, I feel that will do. But again, we'll have to serve our serve the population of India. It's whether in rural area or in the urban slums. It's equally weighted, according to me, and it's not. The thing is that it should be mandatory. It is good that all doctors should do, but again, once you are making mandatory, it becomes very difficult for those doctors who are there in urban areas and who wants to serve the slum populations in their vicinity. So going to a for example, I have been born and brought up in Kolkata, and in my vicinity I have huge catchment area which is impoverished. it's a slum, and they want medical attention. So I feel I owe them much more than the rural population, because these people are equally, what I'll say, they are devoid of medical facilities. So if I'm going and serving these urban slums, I'm doing equally good what a doctor is doing in the rural areas. And one more thing that the government is asking for the doctors to go and serve in the rural population in the initial years. But again, you are left there alone. You don't have any guidance. You don't have the seniors out there. So it becomes very struggling for very novice and amateur doctor there to handle those critical cases. Number one. Number two, we don't even have, the government is not providing that good setup, the infrastructure. You don't have proper electrical backups. You don't have proper that medical facility. So it becomes very difficult for those young lads, those young doctors to go and cope up with in that so uncouth and clumsy environment to go and practice those. And many a times it happens that many doctors, young doctors, who go there and they fall prey to various psychological illness because of the pressure they are facing. And not only that, they are falling prey to many uh, crowd brutalities because when these people come, these rural areas people, they come up with those serious cases, and when these young doctors they fail to deliver, then again the crowd gets very anguished, and it is the crowd anguish brutalities these young doctors are facing. So I feel this concept of having rural practice for the medical young doctors, it's good, but again you need to have that security, that provisions, and the infrastructure. First, these things need to be there, and then the doctors are ready to go and serve.
Absolutely, I am with you in this. So it should not be a compulsion. Anybody who wants to can go, of course.
Yeah,
Right, right. So, doctor, is there a scarcity of doctors in India? Do you really think that the population of India, if we have to cater, do we need more number of seats in medical colleges to, get more doctors on board every year?
yeah. Actually, the present day doctor-patient ratio is about 1:1,500. So it's obviously the ratio is quite short according to the WHO norm that every doctor should cater a population of 1,000. We are doing in excess. So there is a scarcity. The scarcity is because of the shortage of the seats. We are not having that ample amount of according to our population, in comparison to the population what we are having of India, and the institutes which produces the medical seats, that is not at par. Number one, and number two, and the second big issue which arises for the scarcity of doctors is the brain drain. The people who are becoming doctors, once they are qualified, once they have become adept in their field, they are going out because of the insecurities and because of the lack of job opportunities in comparison to other Western worlds. In Western world, you have handy immunizations, you have better facilities out there, and again the security is much more than the security what we are getting in India. Because in India it has become a trend rather when doctors are falling prey to the brutalities of this crowd brutalities. Anything uneven happens, anything happens out of the box, the doctors are held responsible for that. So this is one of the paramount reason that which is forcing the doctors to fly overseas and get settled out there.
Okay. I had a question, which is a little bit on the amusement part or the enjoyment part.
Yeah.
So, how do doctors enjoy? You know, I really want to.
Doctors enjoy. The enjoyment of the doctor is the first enjoyment is when they have treated successfully their patient. The gratification what you get, that is unparalleled. When you see when you are treating a patient in emergency. My personal experience when I was there in my emergency. Uh, I'll just share one incident. One old man came, let's say one old gentleman came about 70, 78 years. It was early morning, and then I just started my emergency duty. He came in, and he somehow managed to got throttled with his artificial tension. the denture got into his throat. And he was rather panting. He was falling short of oxygen. He came in and he was struggling. His face was becoming pale. His son planted, and he was very much restless. So he told that he cannot gulp down anything. He cannot eat or drink water. He cannot breathe rather. So he is in most of the time I tried to reach on to the ENT specialist, but that was a transit time. So the one who was on emergency duty, he couldn't connect. So I took the endeavor. I took that I'll try to take the artificial denture. It was a bit difficult for me. So I somehow I managed after struggling for about 15-20 minutes. I somehow managed to dislodge that denture. I took it out. The moment I took out, the old man, the son beside him, and the old man was there. He felt relief. He started means taking long breath. He gave that sigh of relief. The guy who was beside me. He just fell on my foot. And he started telling me that you are God, you have saved the life of my father. So that incident, the gratification at that point of time, what I got, that was unparalleled. That no money in the world can fetch. So that one enjoyment is when you have successfully treated your patient, or you have successfully done your job. That is the best gratification. Apart from that, the patient needs activities like any other professionals. Especially when we are in our duties, we also have those coffee time, where we can sit down with our colleagues to have a small chat or gossiping. And many of our doctors also very fond of music and all this. So, like any other professions, we also have those recreational activities which we resort to.
Great, 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 great. This question was sauntering in my mind for a lot of time, but yes, that's good to hear that doctors do enjoy their lives.
Yeah, we try to, when in a very compromised, in a very packed schedule we have, we try to squeeze out some time for remuneration just to rejuvenate ourselves.
Right, right, right. The next question that I have, doctor, for you is uh, maybe 75% or 80%, but it happens. I have seen this. So why do doctors only tend to marry, you know, doctors only? Why is
Okay.
it?
It's very much personal.
Okay.
I didn't marry any medical, but yeah, you said it. Say rightly said. Uh, it's because of the mental frequency, the compatibility, rather, the mental compatibility. It becomes very easy for a medico to understand a medico. Because, and for example, when you have married your better half is a non-medico, and again suddenly you get one emergency call, and you'll have to just leave her
Hmm.
aside at night and go and attend that emergency call. It becomes very difficult for a non-medico to gulp down the situation. It becomes very difficult to adjust to the situation. So it becomes relatively easier for a medico to marry and carry on their professional activities. It becomes easier and smooth. And second thing, since in medical colleges we have those clinical activities, so we are being linked. There was complete mingle of people and colleagues. So most of the time you find that doctors are marrying their own colleagues.
Okay.
Colleagues. So it's because of that compatible environment and the mental frequency match. So, and nothing as such that we have any preconceived intent that we'll be marrying only the doctors or the medicals. Nothing as such. It's quite personal.
Good to know that, doctor. The last question, in fact, that I would like to ask you is, I have seen, in Calcutta, in Delhi, in Bombay, in every place that I have been to, even in the villages where I have been to, I have seen that doctors have huge respect for other doctors. And if a family member, for example, I had many, my dad is a doctor, and I had many,
Yeah.
uncles, family friends who were doctors too. So, if, for example, there is a dentist uncle of mine, so I used to visit him, and I used to see that he did not charge me. So is it that it's a preconceived notion that doctors don't charge, other doctors or their family members?
Yeah, yeah. Actually, it's a it's very basic thing which during our college life we have been taught that it's against the professional ethics to charge your own people of your own fraternity. That and see if you are a doctor and the person who has visited you is a doctor or his near one is a doctor, so it's against the professional ethics that we charge them. So it's just the professional etiquette you can say.
Okay. Thank you so much, Doctor. So, the questions that I had in my mind, I've asked you everything. So, any closing address that you would like to give our viewers? I am sure most of the viewers would be, those who want to become doctors or those who have freshly become, they have become a medical officer right now. So, any closing address that you would like to give them in terms of how they should, how their next 5 years should be, how their next 15 years should be?
Um, One thing what I'll say is uh, I told you that I am against the concept of railway. So when I'll ask, I'll just request all my fresh doctors to carry on their professional duties honestly, be patient, and believe me that even if you don't resort to any unfair means, you can earn very good livelihood. So you don't have to run behind money. If you are a good doctor, if you are a good person, you will be making money, and that will be handy enough to have a good life. And one more thing, what I want to request all my doctors, you owe something for the society. So please don't fly overseas for better job opportunities. You will have to serve the nation first, the people of the nation first, your vicinity first. Those who are impoverished, those who are downtrodden, who cannot afford facilities in your vicinity, you go and serve them in your free time and try to be there in your place in the sense if you don't want to serve the rural population, you be there in your hometown because that is your prime responsibility to be there and to do the goodness of the people around you.
Hey, doctor. Thank you so much. I cannot thank you enough for your time, and I know you are so busy right now that Monday to Saturday you are, carrying out your professional duties. Sunday is the only time you have with your family. So, thank you so much. Thank you so much. Please send my regards to your family, and hopefully,
Thanks.
whenever I am in Calcutta next, I'll definitely make it a point to meet you. At least for 5 minutes or 10 minutes, the amount of time you can, offer. And
Yeah,
thank you so much, really.
welcome. Welcome.
Ladies and gentlemen, this was Dr. Mozammil Hassan. Uh, there's nothing much to say about him because he's one of the most humble people that I have met in my life. And he is a very senior doctor. He left his, a very aspirational job at AIIMS, All India Institute of Medical Sciences, due to personal reasons, of course. But of course, he has never, made any compromise with his professional duties. So I request you, his if he is on social media, you'll find his handles in the description. You can contact him if you want to, and I'm sure he will be helping out with his knowledge and his experiences. And of course, anything you can ask him. Thank you so much for watching this video.